Let's play that game they do at the ophthalmologist's office when you go in for your eye exam, shall we? Now, which one is better? This one or two? One or two? You're right, definitely one. It's much more clear. But for anyone in the audience with cataracts, the cloudy image of number two could be what they see all the time.
Cataracts are also the most common treatable cause of decreased vision. There's a lens inside the eye that acts like the lens of a camera, and it focuses the light onto the retina, and that produces an image. And with age, that lens can become cloudy, it can lose its transparency and develop small opacities within the lens, and that causes the light to scatter and not focus well on the retina and causes blurry vision. Cataracts are notorious for causing glare because the opacities in the lens diffract the light and cause it to go in all sorts of directions. And it can be very disabling with night driving. If you're driving into oncoming traffic and you see headlights shining at you, it can be very disabling.
Now, most cataracts are age-related, but they can be caused by other things like trauma, exposure to ultraviolet light or radiation, or as a complication of diseases like diabetes or high blood pressure. There's no medication treatment for cataracts, but it is easily corrected with surgery. Most of the time, only the lens of the eye is affected, so you just take it out and slide in a new one, just like replacing a contact lens.
When a cataract is removed, the native lens of the eye is removed and a synthetic implant is placed in the eye. And the implant is made of a synthetic material like silicone or acrylic, and it's implanted to meet the needs of your eye. So the power of the lens that's implanted is measured to match the original power of your lens. So in most cases, people have their implant designed so that they see well in the distance and need glasses for reading after the cataract surgery. The technology of lenses has also advanced a lot, especially in the last 5 years, with the development of special lenses that correct astigmatism and special lenses that can correct both distance and near with a single lens implant in the eye. These are what are called premium intraocular lenses.
Early cataract surgery was first developed in India, where they used a curved needle to push the cataract out of the field of vision, and then they soaked the eye in warm butter. Then they popped some popcorn and watched an old movie. All right, just kidding, they didn't really do that. Today, cataract surgery is a very short procedure done through a microscopic incision as small as 2 millimeters. And there's no soaking of the eye in any dairy products, and people have reported better vision as early as the next day.
After cataract surgery, the post-operative course is usually fairly straightforward. You need to be on drops for about a month in general, though it can obviously be tailored to the specific needs of every patient. Visual recovery is quick. In most cases, people are back at work within the next few days. They can see better almost always the next day, but usually within a week, they're seeing pretty close to 20/20, if not 20/20.
There are only a few simple things believed to help prevent or delay cataracts. Don't smoke, wear sunglasses or a brimmed hat to block ultraviolet sunlight, and do your best to control any diseases you may have that can cause cataracts, like diabetes. Even with these helpful hints, more than half of people over 80 years of age have had a cataract. So the best thing you can do is be ready for it. Once you hit 60, have a comprehensive dilated eye exam once every 2 years to check for signs of cataracts. Early diagnosis and treatment may save your sight. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.